Hello, everyone, and welcome to the second week of the virtual Iowa Governor's Conference on Public Health. Welcome back to many of you, and welcome to those of you who are joining us for the first time. Like I said, we're in week 2 of our session, and I'm happy to report that we regularly have over 100 people joining us at each one of these webinars. So I'm so excited that we're able to share the learning from our public health experts so broadly every day. My name is Lena Tucker-Reinders, and I'm the Executive Director of Iowa Public Health Association. And I'm grateful you have joined us here today, and hope you will continue to come back and meet with us every day next week, as well as we continue on with our virtual Governor's Conference. As you know, we usually do meet in person to share best practices and lesson learned. And while we miss seeing everyone in purpose, we are grateful for this opportunity that this pivot has given us. Like I said, we regularly have over 100 people attending our webinars. And what that says to me is that, that it's vital that we continue to share best practices, lessons learned, and network with our public health colleagues around the state. The Governor's Conference is put on every year by Iowa Public Health Association and the Iowa Environmental Health Association. We are both nonprofit organizations, membership organizations, and I encourage you to join either IPHA or IEHA to support this work. As I said, we know it's valuable work, and we know that people are appreciating the opportunity to learn from one another, and there's so much more we do throughout the year as well. So at IPHA, our mission is to unite and strengthen the voice for public health in Iowa, which is exactly what we are doing today. I also want to take a moment to thank our sponsors and exhibitors that have allowed us to continue with this virtual Governor's Conference. Their commitment to public health in Iowa is paramount, especially in these times. The sponsors of the virtual conference are Aetna, AmeriGroup, Unity Point Health, and the University of Iowa College of Public Health. We do have virtual exhibitors. I encourage you to visit their sites as well. You would have visited their tables at the conference had we met in person, so I encourage you to check out their amazing work as well. They are ACES 360, Champs Software, Des Moines University, Healthy Hometown, Iowa Corn Growers Association, IDPH Bureau of Chronic Disease Prevention and Management, and the Midwestern Public Health Training Center. Before I introduce today's speakers, just a reminder that everyone is on mute. We're doing this to ward off any Zoom bombers that we might have on the call. We haven't had a problem yet, and I'm hoping that that continues for today and the rest of the conference as well. The chat function is set to allow you to communicate with me and the panelists. I will be monitoring the chat function while the panelists deliver their presentations, and I will relay questions to them at the end of their presentation. So go ahead and put your questions in the chat box or in the Q&A box on the bottom of your screen, and we will get those questions answered at the end of the session. Let's see, for today's session, CEUs, unfortunately, Lynn Fellinger, who was going to talk with us about pertussis, has fallen ill, and we're trying to get her session rescheduled, but it won't be available today. That session had been approved for CEUs, so hopefully we'll get that scheduled another time. Today's first presentation, Aubrey Alvarez with Eat Greater Des Moines, is eligible for CHES and dietetics CEUs. If you are seeking those continuing education credits, please put your name and number in the chat box, and we will make sure we follow up with you. There is an evaluation that you'll need to complete that is available at the IPHA website for the Governor's Conference, and I'll send that link out as well. Go ahead and put your CHES and your dietetics information in the chat box, and you will receive those credits. So now let me introduce today's first speaker. Aubrey Alvarez was with Eat Greater Des Moines. She is going to be talking with us today about what is needed to expand food access, which is such a timely topic given where we are today. So Aubrey, I'll let you take controls now.
Great, thank you. All right. Well, thanks everybody for coming today and listening. I was excited to share about this topic originally at the conference, and I feel like it's extra timely now, just given everything that's happened and the increased need that we're seeing, but also some of the increased challenges that we're seeing with our typical kind of our models in the past. So just to give a little, there we go, get my things moving. Lena already told me that I have to do this a certain way, and Now it's not working. All right, so eGreater Des Moines, for those of you who aren't familiar, we are a small nonprofit based in Central Iowa. We cover 3 counties, and our role is really to facilitate and build connections that strengthen the entire food system. And ultimately, our mission is to ensure that everyone has access to food, and especially good quality food. Today, I'm really going to be talking more about one of our specific areas, and that is food rescue. So we do work in gardens, local food access, farmers markets, but today we're going to be talking a little bit more in depth about food rescue. So, what is food rescue for those of you who might not be familiar? Food rescue is just the process of collecting any edible and edible but not sellable food from where it's at, and then distributing it to an organization that can put it to good use. So that has been restaurants, caterers, schools, event centers. That's definitely changed somewhat right now. There was a lot of food recovery that happened right when places were shutting down, with restaurants and caterers that were unfortunately shutting down their business. But now a lot of our food recovery is focused on some of those places that are still open. And really, I think the main thing to remember is that anywhere there is food, there's a food rescue opportunity. So even at this time where I think we've seen store shelves where sometimes they've been empty, there is still excess in other areas. So, that's what I think is important to keep in mind. And really, one of the main questions we get when we talk about food rescue and food recovery is, the first thing is, well, am I going to get sued? What about liability? So to just get that off of the plate or off your minds right off the bat, the Bill Emerson Good Samaritan Act is actually federal legislation that protects donors from any civil or criminal liabilities when they donate food in good faith. And Iowa also has laws that protect donors. So I think the main thing to keep in mind is, those who have the food, they know food safety. They are doing that when they're serving their clients every day. And it's the same thing on any of these organizations that are serving this recovered food. Is food safety is of critical importance to them as well, because they don't want their clients to get sick. So on both sides, there's great care taken in making sure that whatever food is collected is then handled properly and given away, so that their health is maintained. The last thing anyone needs right now or anytime is a foodborne illness. So again, our role is to just make it easy for those who have excess food to connect with organizations that could use the food. But we're also really looking at our role as, how can we start to think more broadly and really look at how this food rescue system has been developed over the years. And if anything, I think we have learned some really good examples or some good lessons through this pandemic. Is that some of those silver linings is, there were definitely times where I think we've wanted to try some things differently. And unfortunately, this emergency situation has pushed us into some of those opportunities that we are able to see if some of those ideas that we were having would make sense. So one of the big pieces I think we are really focused on is food recovery efficiency. So when you think of how food recovery happens most of the time, even here, most of the food recovery system is built on this volunteer model. So any of the organizations that want access to this food, so if it's a grocery store donating, a convenience store, anyone that's the donor has said yes to donating, I would say like 99.9% of the time from our data, we don't have any donors that are providing delivery. It always falls on the recipient organization to go pick that up. So that could be a school pantry, that could be a free meal site, that could be a church. It always relies on them to go and get that food. And so while that does create a connection there, that's also really put a lot of that capacity. It's a challenge for a lot of these organizations to be able to go and get the food. So there's quite a few organizations that could use this food, but just don't have any capacity to go and get it. And so that's also meant that we're really only capturing about a quarter of the food that's available. So we know that at a national level, at least 40% of all food that's prepared and available is wasted. And within our own landfills, not only has organic waste grown over the years, but the amount of waste that was still in its original packaging made up 7% of that. And that's really unfortunate. So what we've done is we have, created this system that's reliant on volunteers and only captures a small amount just because of capacity. There's just not enough when you think of how often a lot of these places that are donating want someone to come at least 3 days a week, if not every day of the week, because they don't have the storage space. So our goal would be that if we could do this more efficiently and kind of work together to say who's going where, where is the food available, where is it all needed, how can we work together, that we can capture more of that food that's available while also giving back that time and capacity to these organizations that are doing more than give food. But that's really been one of the pieces that we've been trying to look at and work on. The other piece, and kind of what we were talking about even before, was expanding food access. So, we're based in Des Moines. We have amazing food pantries and free meal sites that have been around for a long time that are doing great work trying to meet the needs of those who are experiencing food insecurity or hunger. Even with all of those resources here, we still have a lot of people, at least 100,000, and this was before COVID, that were food insecure. So there's a lot of reasons why someone might not be able to get to a food pantry or a free meal site. Maybe their hours of operation don't align with when they can get there because of work. Transportation, type of food that's available. Maybe they just don't feel, they're not treated well, or they don't, their dignity or pride. We see this a lot in smaller communities where everybody knows everybody, that it makes it hard to go to the food pantry if you're going to know, the person working there. So, this has been one of the places where we know that those food pantries and emergency food pantries play an important role. But there's also other places where people are, and this is where we have been trying to think more broadly, is where are people already located, and could we put food there safely and give it away for free? So even before all of this COVID stuff happened, we had been looking to where are other locations that people are located already who could be experiencing food insecurity, and could we put food there? So affordable housing communities, medical clinics, mentoring programs, sports programs, anywhere that there are people that if we offered them food, could it help them out? And really what we found was, yes, that would work. So we started in April of 2018. One of the ways we put together not only the efficiency, but then also the expanding the food access and where people are, was through our partnership with Come and Go and Wesley Life Meals on Wheels. So like I mentioned, that transportation is a gap for a lot of things. Access to medical care, access to food. Transportation is just hard for a lot of people, whether it's urban or rural settings. So we partnered at the time with Wesley Life, and we paid them on contract to then pick up food from Come and Go locations every Monday, Wednesday, Friday, and then deliver it to around 40 different locations throughout the community. So when we first got started with this, in our area, Come and Go, initially they worked with our local food bank partner, and the food bank did the best they can. They matched as many of those Come and Go stores as they could through agency enabled, is usually how it's referred, and that's really where the organization receiving the food goes and picks it up. So that got about half of the stores covered. So we were able to focus on all of those stores that still wanted to donate, but there weren't any agencies that were able to go pick it up on a regular basis. So that's really where all of our stores were located, in the suburbs. Those were a little bit farther away, and that's how we really built this pilot. So how it worked was every Monday, Wednesday, Friday, we had these Meals on Wheels drivers that would drive to these Come and Go locations. You can see in the photo that all of the food, so Come and Go's policy is that they won't sell any items that are over 72 hours old. So I don't know about you, but there's definitely things in my fridge that are well over 72 hours old. There's nothing wrong with it. It's still healthy, it's still edible. It's just not meeting their quality standards, so they aren't going to sell it. So what they do is then they collect all of those items that they're individually packaged and prepared: salads, sandwiches, wraps, cut up fruit, yogurt parfaits, and they pull all those items and then put them in the plastic containers that you can kind of see here in their cooler. And that's what the drivers pick up when they go every Monday, Wednesday, Friday. So then those packaged items are then taken to our partner locations. So to date, that has provided a almost $3 million tax benefit to the donor to Come and Go, but it's also provided over 775,000 meals to a lot of new locations. You know, because a lot of our partners initially, through their partnership with the food bank, had already had access to the Come and Go food. That's really where our trying to expand food to where else were people at. That's how a lot of those affordable housing partners came in. So we reached out to Conlin Properties and asked them about being able to partner, and if we provided the food, if they had a way to safely distribute it to their clients. And they were incredibly excited about it. And because of the timing, we knew that it was April, so it was a lot of children and kids that were out of school that were using this food. So it has really made a big difference, and it's been something that now we know that it works, and we want to see more of that happen. Going back, ChowBank is the other technology piece that we use to try to help make those connections. So ChowBank is really, it's a smartphone application or a website application. You're all welcome to check it out at chowbank.io. And really, this is just a tool that takes us out of the middle. So it allows any of those organizations that have food or a caterer or convenience store, grocery store, to put out their donation, and then organizations that are registered, we do only work with organizations, they are able to see the donation and then accept or decline. So it just makes it easier for those two groups to connect with each other without us being in the middle. So really this pilot program, the transportation program that we worked with, kind of got the ball rolling in thinking, how could we do more of this? So for us, expanding access has really we started in April of 2018. So you can see we have a variety of community partners now that, the main thing for us, like I said, is it doesn't have to be a food pantry or free meal site. If they are serving the public and have a good chunk of their people who could use a free meal, we want them to have it. So we have places like our affordable housing communities. The Perry Public Library is a great example of a program that got launched right before all of this COVID, where they have put in, the library director there has been a great partner, and they put in a glass front refrigerator. You can see the help we had to get that in there. It was a little bigger than our team member had planned on and wasn't able to move it by himself. But he was, now they rescue food from 2 grocery stores in town and then have it in their refrigerator. And it's just available for anyone who wants to get it. And that's really what brings down the stigma, it's access. We kind of liken it to the break room. If there's donuts or bagels or, extra fruit in the break room, I don't have to prove that I'm hungry. I don't have to do anything. It's just there to share. And that's really how we want this to feel, is this is all food that's extra. We want people to just feel like they can come, have it, and, just enjoy it. We've also expanded. So while we started with Wesley Life Meals on Wheels, one of the things that, we've had more partners, so looking to see how we can utilize excess capacity for vehicles. So one of those examples is Iowa Brew Tours. So The Iowa Brew Tours does brewery tours, obviously, in the evenings and on the weekends. So they had a really nice van that was available during the day and someone who was willing to drive it. So we contract with them to do food recovery as well. And that's really been critical. One of the things, so we were doing all of this before COVID. And if anything, what we've learned through COVID is it's working and it's really critical now. So now we have changed, we've moved to no contact food recovery and food delivery. So you can see our drivers are now wearing masks, and they are also given sanitizing materials, and they have gloves. So they go into the Come and Go store, they pick up the totes of food. When they get to their location, they leave the totes outside of the location and then call or text and then see the person come and collect it, and they take it inside for to put in the refrigerator. We've also, through all of this, because Wesley Life, obviously, they've had to really step up their services and do a lot more delivery. So it wasn't going to work for us to use their drivers for the time being. So we've been able to hire more drivers and get them trained and get them material so that they can be the ones doing that food recovery. And because we are paying them and there's consistency, that has allowed us to, one, provide the drivers with all of the materials to keep them and our partners safe. And it allows us to do those safety controls and the tracking. So all of our drivers have thermometers. They all have tracking logs that show how much did they pick up from each location, how much did they drop off at each location. So it's helping us also show the impact. One of the other kind of accidental things that has happened just because of, we had hoped to start to supplement our food recovery efforts with more fresh produce. Not to say everyone loves a corn dog and the chicken sandwiches, but what goes fastest at these locations is the cut up fruit and fresh vegetables. That's what people are really wanting more of. So it just so happens that because, unfortunately, some of these, while a lot of restaurants and schools have had to shut down, that has meant that some of our local distributors, like Lafredo Produce, has a lot of extra product. So we've been working with them. We call it Operation Fresh Produce Drop. And so generally, Lafredo works in pallets. So that's not something that we would ever be able to do. A lot of our partners would ever be able to do is order pallets of food. That's too much. But cases, that's something we can work in. So luckily, one of our team members has been working. So he sends out, we get a list from Lafredo of kind of the items that they call them their hot push items that they're looking to move, and they're at a deep discount. So it could be $1 per case to $4 per case. Stephen on our team will send that message out to all of our partners, and it's open to any organization. So they could be a food pantry, or it could just be a church that's looking to provide more access to their congregates. We've had a lot of refugee and immigrant organizations that are doing what they can to serve their neighbors. So we're open to any organization that wants to order is welcome to. So everyone orders, and then the produce truck pulls up. These are pictures from, we've been doing this in Polk County for 4 weeks. This week we just expanded to Warren County. So in Warren County at the Helping Hand Food Pantry, she had lined up some high school students so that they could help just with the unloading of all of the produce. And then really how it works, you can see Stephen right here is we have what everyone ordered. So anyone that comes through, they stay in their car, and our team of volunteers and staff will then load up everything that they ordered and put it in the back of their car. So it keeps that social distance while also has really expanded access to fresh produce. And we've had on average around 20 organizations that have been ordering every week. And it's been, really exciting for us just because, for our mission is we know there's extra good food out there and we want people to have it. And so anything we can do to make that connection easier, that's exactly what we want to do. So with that, I think, what we have learned is, there's always new challenges. Obviously, I had worked on this presentation before COVID, so there's been even more challenges. But I think, for us, we're small, we're able to, really talk with our partners and our staff and just, see how can we make this work. So one challenge that we've run into is a misunderstanding regarding the food donor enhanced tax benefits. We had someone reach out to one of our donors and tell them that because we weren't, the food wasn't going to a food pantry, and then we weren't meeting the IRS defined terms for need. So we reached out to, luckily, Harvard Law School and Food Policy Center has said that, the IRS and Congress, there's no proof of need required. So really, looking at the way that we're doing this, why not only providing food to the food pantries, but also putting food where people are who might be experiencing food insecurity. Really, what we've looked at as anyone who's taking this food is needy. You needed a sandwich. You needed it right then. We talk about that it is recovered, and that they're actually helping us by making sure that this food doesn't go to waste. So we just want to make sure that that's very clear, that you don't have to be a food pantry to distribute food. So I think that's usually one of the biggest misnomers in a lot of these communities is we've talked to is we can't do this, our food pantry, we don't have a food pantry, or our food pantry is only open one day a week. That's okay. Where else are people? Where are the affordable housing communities? Where are schools? Where are people, the library, city hall, where are people at already? Is there a way you could build a partnership? Do they need a fridge? What could they do so that they can get access to that food? So I think, that's what we're really trying to do, is help people, think about how can you just make it easy and dignified and safe for people to access the extra food that is in every community, and trying to find a home. Another piece that we run into is regarding exclusivity. So there are quite a few places that if you reach out to them, we've had a few, we run into it too, where they say, unfortunately, we can't donate to you because we can only donate through this organization. So sorry. Well, that's definitely something we run into now and still run into it, but there are other ways to approach this. And so we also have organizations that they start there to say, like, yes, we recommend that you donate for consistency, especially for a company that's nationwide. For consistency, it makes sense, whether it's a Feeding America food bank, starting locally with those nationwide organizations to say, yes, this is the best way to start. But that doesn't mean if there isn't a partner there that can accept that food, or, in my hometown, there wouldn't be the food pantry there isn't actually through the Feeding America food bank, but that doesn't mean that food pantry can't use the food. So, we like to highlight some other organizations that have this same approach to say, yes, you should always start here, but if for some reason they can't accept it, it doesn't work for them, then go to your local nonprofit hunger fighting organization to see if they can accept the food. So it doesn't mean that's the only option. It doesn't mean that they shouldn't do anything. There's definitely other ways for these companies to stay involved. So I think that's kind of how we've looked at this. Hope you like our images that we put together, but really the highest priority should be getting that excess food and distributed safely within the community. So what's most important is, for us, we want the food to go to those organizations that already have the trusted relationship. So that could be a church. That could be, we've got some really great, Knock and Drop is one that I just learned about here locally, that she has a great relationship within the Latino community. She's a trusted resource. So she's the one, she's actually bagging items up, whether it's food, personal care, and then taking them directly to people and leaving it for them. that's someone who already has the trusted relationship. We want her to have the food so she can keep doing it. It's the same thing with these churches. So how can we support those in the community that already have the relationships with those who are in need, and make sure that they have not only the food, but also the equipment so that they can store and do it safely. So, we kind of liken it to, I think you might have seen it on, social media where they have the jar and it's full of big rocks and it says, is this jar full? Is there anything else we can fit in it? Nope, can't. Well, then you put in the smaller pebbles and those kind of fill in, in between the cracks. And then you put in the sand and that fills in even more. That's really how we look at this food rescue and these opportunities as, yes, we have these base meal sites and emergency food programs, but then we start to add in the smaller, littler pieces that are there to supplement. This isn't an either or situation. This is an and. How can we support our pantries and support those that the pantry doesn't work for them or that the hours don't work? So this is really, I think, just trying to look more broadly at your community. So for us, this means, we are definitely continuing to try to fill the transportation gap. If anything, what this has shown us is that when COVID hit and we had all of these places closing, a lot of the food rescue stopped for those organizations, whether, their volunteers that were there were in the high risk category. They, the stores, they didn't feel like they were going to have the consistency, so they put a stop to it. Our come and go, our paid driver, because we could confirm that the drivers would be there every day, they didn't have to worry about it. That has continued. That's been something that's gone on while a lot of these other pieces have fallen off. And so I think it's shown us why there's value for everybody. There's value for the donor, but there's also value for the organizations receiving the food to put resources into keeping the system going. We are also working on, redirecting the abundance of baked goods to make space for healthy items. That's been less of a problem just recently, using technology and collaboration, and then also trying to, mostly right now we're looking at, because of farmers markets being delayed and maybe not open, definitely not opening in May, but who knows when they're going to get opened, knowing that we have local food producers and farmers who may have excess crop available as well that they had planned on selling to the farmers market. So we are planning on moving up our gleaning operations, which we will coordinate the volunteers, and it's a great activity for social distancing because you don't need a lot of people. Those volunteers will then go into go to the farm to harvest all the product. We will pay the farmer for the product, and then all of that produce will then be incorporated into our weekly fresh produce drops. So it's kind of a win-win opportunity. We have been, in the past, we have also experimented for trying to find a new home for all of that bread. We have our Bread to Beer program that was very fun last year at the state fair. So we were planning on replicating that again this year. Obviously, it's a little delayed, but hopefully by, I don't even know, later summer, sometime we'll be able to share this with you. Our dashboard is another piece that we're very excited about, and really hope that this is something that we have it here for Central Iowa, but that it's really available for any community. That will show, we, with the support of the Greater Des Moines Food Rescue Network, are starting to show just pulling all of the food providers in our community, who's donating and who isn't. So that's going to be a great resource for all of us. And like I said, gleaning, we're really excited we did a lot of apple gleaning last year. So starting earlier, we'll have, some different stuff to donate, hopefully. But not only did this go into the emergency food, food pantries, but we also, our partners at Wesley Life, were able to turn it into applesauce. So we're and different products we'll have this year. But I think if anything, what we want all of you and what we've really been looking at is how can we invest in shifting the conditions that are holding these problems in place? And if anything, I think what we've seen from COVID is that some of these systems that we built fell apart really when all of this went down. And so how can we start to rebuild it better and really put more emphasis on some of these pieces that worked, and use this opportunity to make food access easier for everyone. So with that said, here is our contact information, and I look forward to any questions.
Thanks, Aubrey. In full disclosure, Aubrey and I are office mates, and so I've known for a long time how awesome her program is, and I'm so happy that you're able to now share it with so many other people. We've had some questions come in while you're chatting, and the first one is about the Perry Library, and the comment is, I mean, this person must live in Perry or live or work in Perry, because she's saying how awesome this is to have this at the Perry Library, but now libraries are closed, and so what's happening to that food that was previously going to the Perry Library?
That's a great question. We have been actually working to try to redirect the food that was going to the Perry Library to another program. Actually, Knock and Drop is still operating. We've had some challenges with just getting those two donors to shift. So it's a lot of food rescues about relationships. So that food is still available. With the library closed, we do have a home for where it could go. We just haven't been able to get the donors to say yes yet, which is sometimes a big challenge.
Great. So the next question is about location. And so obviously your name is Eat Greater Des Moines. Your focus is on the Greater Des Moines area. What opportunities are there for this project like this, whether it's Eat Greater Des Moines or something else, to expand outside of the metro area? What advice might you have for others who are wanting to replicate your success?
We would be happy to help anyone replicate it. So Eat Greater Des Moines, we cover Polk, Dallas, Marion, and Warren counties, and that's always our intention, is to stay within this small space, knowing that's our limitation. But we are happy to get other organizations and groups started. So if there's any questions or, how do you do this? I know I'm from Southwest Iowa, Red Oak, Iowa, so I've been trying to get my mom, in my community to replicate the same thing there. So if there are groups that have questions or they're wanting to do something similar, I encourage them to reach out. We are happy to help you get started. I know Lynn County actually has been doing some great work, and they have started to do some similar things there. So anything we can do to help, we're happy to do it, because we want to stay where we're at, but we definitely want to empower other communities to work and see what resources you have and make the best use out of them.
So then the next question here is about food spoilage, and understood that 72 hours, like you said with the example, I certainly have food in my fridge that's older than that too, but eventually food does spoil. And so what happens, and who's responsible for the food that is donated, is received, and is in one of these break room fridges and then doesn't get taken?
Yeah, that's a great question. So what happens with this is, our food recipient partners, they are always the first line to say, if something, even if it comes right away and they pull it and they're like, this just doesn't look right, to toss it. So that is always a priority, is if you wouldn't eat it or if it doesn't seem safe, to throw it away. But that's the other big piece, because we're consistently providing these donations every Monday, Wednesday, Friday, every Tuesday afternoon, the fridge gets cleaned out. So these fridges get cleaned out way more often than my fridge at home ever gets cleaned out. So they have to make room for the new food coming in. But we always want whether it's through this food recovery program or just some of these others through Chow Bank, the recipients, they are always empowered and encouraged that if something doesn't look safe or doesn't seem edible, to throw it away. And that's also why reporting is really important for us. We don't want to overwhelm locations with more food than they can use, so that they end up tossing all of the food. So too much. So that's really why we have these relationships with all the partners, to say, how much is the right amount? Is 2 totes enough? Can you go through that? But we don't want to overwhelm places so that they end up throwing away more than they're able to use.
Okay, here's a quick one, and then I've got 2 wrap-up questions. The quick one is just, do you know the distribution sites in Marion and Warren County off the top of your head?
Yes, well, in Warren County, we have Norwalk has been doing a really good job. They have Come and Go Food going to 2 apartment complexes. In Warren County, the Operation Fresh Produce Drop has been happening at Helping Hands. The orders go in on Monday, and then it gets delivered on Tuesdays. So anyone, the one in Polk County happens on Tuesdays, the orders go in. Wednesdays, the produce gets dropped off at the hall in Valley Junction, and we are looking to do the same thing in Dallas County.
Okay, great. And you can always, anybody on the call can always contact Aubrey for more specifics too.
Yep.
So this one, it kind of relates to your gleaning, and with the food that's potentially going to waste in fields this summer, and with restaurants not being operational, what kind of work is happening? What kind of partnerships are happening to get restaurants to engage them in making meals for food insecure, even perhaps summer feeding programs with the schools? What kind are you familiar with partnerships like that, or are you involved in that?
I know that, there's definitely been some of those partnerships. I think I've seen like the station in Ingersoll has been doing a lot with making shepherd's pie and getting them to YMCA supportive housing. I think it really just depends on the restaurant and their capacity. Does it make sense for them? Because they still have to order the products, they are paying their staff. So really finding out what's going to work for them. But there have been the summer feeding sites, and the schools have really done a great job of pivoting and providing these summer meals or, lunch meals right now and keeping that going into the summer. So there has been an opportunity to, we've looked at with gleaning or any excess items to provide those to the schools so that, when anyone comes to take their sandwich or their lunch or breakfast for the day, they can also have access to whether it's fresh produce or, other items that might go out. So, I think that's a great way to look at if there are food programs already going on, how can we support them? And, for us, the main thing with the local restaurants is just using them, ordering from them where possible, and, making sure that people still know about them, because with those and caterers, it's a really tough time. So if there is a way, but you have to get paid. So if it's going to be enough for them to be able to pay their staff, it could work out. But I think that's one big thing to keep in mind is, the labor it takes to also put into producing the food.
Great. And I love this last wrap up question. It kind of gets back to the systems thinking. So what other gaps do you see that are still related to food insecurity? Kind of what else needs your jar metaphor? You have the big pebbles and you have small rocks in the sand. The last thing we had is the water. So what's the water? What do we need to fill the gaps?
I think if anything, what we have seen right now, looking at the global supply chain is a mess. It's challenging right now. And what I hope a lot of us are starting to learn and appreciate is all of the potential we have for production here, but a lot of those challenges are coming into, we have farms that are, raising animals, but where can you get those processed? With a lot of these larger processing facilities closing down, the local meat lockers, which have really started, there's not very many of them. It might be a 5-month wait to get in. So we really need to look at how we're supporting some of these local, whether it's commercial kitchen, processing facilities, meat lockers, so that when we have the food, we're able to get it processed and then out. So that's really some of those kind of bigger system things, is what are we doing so that if one facility shuts down, we don't lose a whole supply chain. So trying to, look more locally is, how are we supporting those local farmers so they have access to crop insurance? What do they have for aggregation and distribution? What do they have for processing? I think this has been a really eye-opening opportunity for us to say, how have we built this local food system, and maybe how can we start to, as we rebuild it, add in more of those supports so that we have all this capacity to grow food, grow products. Can we shift to growing more food? Maybe, I think those are all some things right now that as we're starting to rebuild, we can place more focus and emphasis on not only growing food for people to consume, but also making sure that we have the processing facilities so that we can consume it.
Great. Well, thank you, Aubrey. Thank you to Stephen and Joey, who aren't with us on the call today, but I know are doing amazing, great work. I know this conversation can go on for a long time, so I thank everybody who submitted their questions, and I will share those with Aubrey, and I encourage you to reach out to her directly to continue the conversation. So moving on, we have one more presentation today. Mike Bell, Nora Godel, and Greg Jameson are with us today from RDG Planning and Design, and they will be discussing how intentional design contributes to community health. So let me send it over to Mike.
Thank you. Can you hear me?
Yep. We can't see you yet, though.
Okay, I'm going to go video.
Perfect.
So we have, Greg, do you want to introduce yourself?
Yeah, so I am Greg Jameson. I lead RDG's geospatial platform, and I have a background in meteorology climatology.
And we are waiting for Nora to jump on the line.
I'm on the line, but it says I cannot start my video because the host has stopped it.
Haha.
But I am Nora Godar. Oh, there we go. Hi, I'm Nora Godar, and I'm an architect at RDG Planning and Design.
So can everybody see the screen?
Yes,
Nora, do you want to kick us off?
I certainly will. You want to move? There we go. Look at that. Hi. Thank you for listening to us virtually today. We're going to talk about creating healthy spaces. We just introduced ourselves, Nora, Greg, and Mike. Today, what we're going to learn about, we're going to talk about the social determinants of health and the relationship that you all are very aware of, that we're just going to share a little bit more about how we have gotten to where we are. And then we're going to end the presentation today with a challenge for all of you, action plan on how you can take what you're doing on a daily basis and help us and the greater communities. As we mentioned, we're from RDG Planning and Design, and who we are, we're a multidisciplinary firm, everything from architecture to landscape architecture to GIS. We've got multimedia, we've got graphic design, sustainability, lighting. We are in all over the country now more than ever, now that all of us are working from our home base locations. Primarily before COVID-19, we were in Des Moines, Omaha, St. Louis, and then we have some individuals that are sprinkled across the country from Florida to New York City and down in Arizona. I hope that when we're done here today, that you are encouraged by what you hear, and check us out online. What we are all about is creating meaning together. And now to Mike Bell.
Nice job, Nora. So one thing that I've been tremendously interested is the determinants of health. And as I have had a great opportunity to work with a lot of public health professionals, they have helped me realize that the impact that the built-in natural environment has on our public health and well-being. And so the question is, every time that I'm working with a city council or a governing board, I always question, what is it that we value? Do we value the cost of the infrastructure, or the value that that infrastructure will provide to us from a quality of life, performance, and health perspective? And so Mary Mincer Hansen is an absolutely wonderful woman, and she has helped me realize that whether you have a genetic code or healthcare, that the determinants of where you live and the type of decisions you make within that place have a greater likelihood of your health outcomes and your life expectancy. And that's a pretty incredible thing in my mind to realize. We are, as a design profession, the tip of the spear when we are developing. Think of the places that you're in right now. A developer, a contractor, design professional either designed it, planned for it, or built it. The question that I would have for you is, what kind of thinking went into the block that you live on, the house that you live on, the community or neighborhood that you live on, or the region? How much decision making was made by a public health professional? Or were those things built purely on the understanding we knew we need a house for people to live in, we needed a transportation system to get from point A to point B, and we needed a neighborhood or a community because we needed to house those people, have a place for those people to work, have a place for those people to be entertained and to live their life out. In doing all of those decision making, how much was planning, or how much was public health incorporated into each decision made? And so as we are thinking through the built-in natural environment, my challenge is to you, and that's my hope throughout this whole design presentation, both Nora and Greg and I would like to make sure that we offer the opportunity for public health professionals to be the bridge between the decisions that we need to make to create place and the opportunity and the knowledge that you have to make those places more dynamic, more successful, and more healthy. Cities are they only reach their potential when they become healthier places to live. And so as we start taking a look at where were we in the development of New York and London and Paris, when those things just exploded in the 1830s, 40s, and 50s, we actually found that they lost their potential because they were over inundated by a population that community wasn't ready to serve. And so we know that there is no reason why we can't make the cities that we live in right now healthier places. And so a little bit about the built environment and its relationship to public health. What we'd like to do is walk you through where we've been quickly. There's this great artist who's created this great diagram without getting into a 2-hour conversation about the history of planning. But I'd like to walk you through over the last 100 years of maybe some of the decisions that were made, where we're at right now. Nora will talk to you about maybe we're on the cusp of something great. And then how do we look around the curtain or the corner and see how we can, from a public health perspective and knowledge base, improve the places by creating relationships. Quick little narrative. Robert's just this great artist and created what I think is a great diagram showing how planning really is an evolution. Planning generally in historical context wasn't done in one day. It was an evolution of, oh, there's this great site and we need to get to that great site and we need to maybe create a level of settlement in that great site. And then as technology change or innovation creates these paradigm shifts, like the railroad, we need to modify that city so that it can accommodate volume or different types of transportation or different types of commerce. And the question that is so well illustrated here, was that all done in a way that created the most optimal, healthy place for people to live? What were the value statements that were created in the decision making in creating the place? And so as we think about where we're at right now, from a settlement that came from the majority of it was agrarian, and now the majority of us live in an urban environment, how are we making decisions? Back in the day, from a planning perspective, we used to decide based on the parcel, based on the property that I live in. Then we realized that we needed to think a little bit more regionally, and maybe it was the block, or maybe it was the neighborhood, or maybe it was the portion of the community. What we realized in the 70s and 80s is that old thinking won't get us to a desired paradigm. We realized that we needed to think regionally, nationally, and globally. And so the question would be for us is, what is our definition of thinking more holistically or thinking sustainably? And that's really up to each one of you. There is a nationally recognized definition, but it really comes up to each one of us and how we want to understand our own definition of sustainability. And then there are a series of other buzzwords out there. And one of the ones that I have a tendency to like to think about is resiliency. Our firm tendency to work in the Midwest region and beyond. The Midwest region is impacted more and more so by flood events or rain events that are changing the way we think about our built environment. And so we need to think, how does our community, how are we impacted by circumstance, and how can we be resilient through coming through that circumstance and potentially be better off because of that circumstance? We also are realizing that there are a series of other realities that are trying to make us more sustainable, from energy consumption and management to how we think about individual buildings and how we think about those buildings and their performance. I know that one of the things that we looked at here at RDG back in the early 2000s was we wanted to make sure that we had the opportunity to become a lead firm and work on projects that were really focused in on making that building perform better, making the mechanical systems work, making the lighting systems work, making sure we don't use the carbon that we used to. And so we really wanted to have a real focus in on building performance so that we could save money, save the environment, which is a very, very lofty thing to do. And as we started moving through this reality, some of us started thinking, you know, it's not enough to make sure that a building performs well. Isn't it really how we want to perform within that environment, or we want to experience, or we want to have a healthier experience or a healthier outcome, a more mentally balanced experience within that building, within that landscape? This diagram I'm going to stop on just a second. You know, being in a firm of 180 plus people, we have a tendency to talk about woe is me and what's the outcome, what's the future going to look like, and how can we possibly live up to these objectives that have been set? How can we reduce our carbon input and output? Well, we are living in a time right now, and there are images of China or where have you, that our pollution over the last month and a half, because of this pandemic that we're living in, there is a bit of a benefit to this pandemic. It is proving to us that we can produce less carbon, that we can pollute less, that we can actually change our environment up to 5% of our emissions within a month period of time. I think that as we get through this pandemic and we look at these guidelines that we're trying to better understand and better live up to, we're going to rewrite these guidelines because we proved to ourselves within a short period of time that we can make favorable change if we choose to value it and if we choose to pursue it. Another thing that we are always trying to better understand is just the level of energy and level of output that we create, and what other standards that are on the books right now that we will want to understand and live up to. And then we are starting to get more into, as these standards progress, identifying the individual in the building, not just the performance of the building. And this is where I think, and Greg thinks, and I know Nora thinks, we are breaking great ground and finding great opportunity in the new standards. So Nora, if you could take over a little bit.
You bet. So Mike has kind of brought us up to speed as to where we are today. Some of you may have heard of the Well Building Institute as a sister organization to LEED. And the way that it's changed between LEED and Well is now, instead of just focusing on the mechanical and the functionality of the building, it's a holistic approach to health that includes the occupants in the building as important parts of architecture and being a well person. We spend over 90% of our time indoors, and what the well system really measures, it's a focused education that is fact and data driven, that shows that when people are in an environment that they are comfortable at, both emotionally and temperature wise, and in terms of the air blowing at them, they perform better. Well buildings have a increased amount of productivity. Individuals that are living and working in well buildings are less likely to call in sick to work and are more productive while they're at work. In addition to some of the things that you would think an architect or a design firm would deal with well, they also deal with nourishment, fitness, and mental health. One of the growing concerns in our society is mental health issues, and a well building takes steps to ensure that individuals have places for different levels of feedback coming at them, light levels, temperature levels, areas that they can focus and areas that they can collaborate. So this system has existed for only a couple years. RDG has just recently had a International Well Building Institute certified building in Pennsylvania. It is a senior living facility. We are currently working on our own office at 301 Grand here in Des Moines, and also have worked on some other projects in Omaha with consultants trying to build this full picture of what an occupant and what a building can do together towards health and wellness. It is an international, as it says in the title, it is an international institute. It's starting up here in the United States, but it has been widespread in Asian countries and European countries for several years now. A well building does not necessarily mean a lesser design. It's pushing forward the thought of what good design is as it relates to light levels in the building and natural daylighting and light and windows to look out at nature and be a part of that, communicate with that. You'll see Shanghai, oh my goodness, in the last 20 years, the changes that they've made. China is one of the leaders actually in the well building push.
And one of the things that are also taking place then are there these not-for-profit or other entities or agencies that are either organizing or partnering with to help everyone understand the opportunity that how community can be more engaged in creating a healthier lifestyle, or a healthier infrastructure, a healthier community through how they plan, how they developed, and how they interrelate. And so we're thrilled to death that the Healthy Estate Initiative is actually in our office here in Des Moines. We give them free space because we think so highly of what they do and how they go about trying to better communicate to the residents of Iowa on how to be healthier. And so the future. So the question would be, we know from a planning perspective that it's an evolution. Unless you live in China and you're literally building communities overnight or within 20 years that would house 50, 100, 200, 500,000 people, and that is literally taking place. But generally in the United States or in the States, it's an evolution. And so the question would be, how do we better understand where we've been, where we're at, and maybe more importantly, where we're going? What are the indicators that would help us so that design professionals and public health professionals can work in concert with each other and plan for that unforeseen future? And we think that, we don't think, we know that, as I said earlier, that the world is becoming less rural and more urban. We know that the reliant of energy and the dependent on favorable nutrition becomes increasingly more important, and that to be able to get a container of blueberries in the Midwest, we have to go to China, put it on a boat, and get it here. And it's less costly to do that than it is to grow here locally. And if you equate that transportation, that whole system of just getting a box of blueberries, and account for this population explosion that we're going through right now, logistics and energy consumption becomes that much more concerning. One of the things that we're interested in is then, how do you see what is out there in the future? There's a gentleman from Russia who was an economist back in the Depression, or shortly after the war, that started to look at our development in these cycles, and he called it the wave of innovation. And he said these waves are really based on someone or a group of people thinking how to improve a certain circumstance or create through innovation some level of technology. And that technology isn't just a local thing, it's not just a regional thing, it's national or international. And so an example of that would be, over these courses of innovation of 50 plus years, there are these waves. There's the beginning of the wave, there's the crown of the wave, and then the decline of the wave. And the only thing that really gets us out of that wave of innovation with these economic booms and busts is that next wave of innovation. And generally that wave of innovation, the second one, builds upon that first wave. And what's interesting is you have these primary innovations that are driving the wave, but then you have a series of secondary circumstances that are either beneficial or tremendously detrimental to society. And so what we'd like to do is just show you the first wave and how our society responded to it. And then we'd like to end with what's this next wave that's coming, and we're in the middle of it right now. So the wave that we'd like to discuss right now is the wave of innovation that started in the Industrial Revolution in England that totally transformed our world. It started to create the ability for people to move from an agrarian perspective into an urban perspective and make a living, have a family. You may even benefit by growing into what now is the first time in the world history, a middle class. But that wave of innovation, as dynamic and dramatic as it was, really relied on immigrant and low-wage workers to move into a community, to move into a city, and in that city, feed the fuel of that industry. And so what we used to have back in the history of our planning, from the Renaissance time of Italy and France to the England period, where we build our cities and organize them around these plazas or churches. Now we started organizing our cities around places of industry. And those places generally weren't necessarily there to begin with, one, and two, didn't accommodate residential. And so we had to create residential incredibly quickly without an idea how to bring drinking water or portable water or sanitary systems, because those things weren't necessarily system-wide invented yet. On top of that, then, you would have the series of pandemics that would hit these urban centers, because those urban centers were way overcrowded and didn't have the ability to accommodate a healthier series of choices. And so all of our heroes would be John Snow, not the John Snow that we all know today, but the John Snow from the 1830s, 40s, and 50s. He realized that there was a cholera outbreak in London. He also, because he was a physician and a scientist, wanted to study it from a systems perspective, not just an individual perspective. And he was able to identify and track where these people that were sick were housed, and started to correlate what the relationships were of these people. And we're able to realize that it was borne out in water, and it was located within a well that the majority of those folks got their drinking water from. And so he was able to communicate that and better understand that and modify the way that we start looking at drinking water. And so that happened in the 1850s, and there are a series of things that were taking place in the 1850s, the 1870s, and 80s. Again, cities were exploding, terrible living condition, but a lot of that was borne out in the previous wave from 1870 or 1770s to the 1820s and 30s. And so over the course of the next wave then, because of this pandemic, or not because of this, not pandemic, but this cholera outbreak, from the 1870s and 80s through the 1920s, there were more dollars spent by municipalities in creating better drinking access, sewage systems, and gas than there was by the federal government in all of its expenditures, with the exception of going to war. And so cities realized how important it was, born out of the first and second wave, how important it was, if we're going to make our cities truly live up to our potential, we've got to create healthier environments for them to live in. Another thing that people realized is that because of these pollutants that were coming out of these stacks, we needed to create these lung systems or these park systems for places for people to go so their kids could play, so they could see and be seen, but more importantly, started to clean the air in which everyone breathed at the time. And so we had our first municipal park in the United States in the 1850s and 60s. Again, railroad and transportation. Now all of a sudden you have these cities, you have a need for burgeoning commerce, but you've got to transport these materials. And so for the first time ever, we started to think about regional systems from a transportation standpoint, both roads, canals, and railroad. And so the question now is, you can see how that first innovation of creating a steel that could then create iron and that could be power by water, and you create mechanical systems and textiles and commerce that create this middle class, but created this overrunning of cities. The second and third waves spent much of their time trying to figure out how to retrofit the benefits of that first wave. So the question that we have today, what have we learned in the third, fourth, and fifth wave, especially from an information technology perspective, that we can utilize in this sixth wave and make healthier environments perform for us, not against us? That's where we need public health professionals to come forward and work with design professionals and people in leadership roles so that we can make healthier communities in the future. So the action plan. Greg and I are going to walk you through some of the things that we have done in-house here at RDG, but the only reason we were able to do that is we realized 10 or 12 years ago that public health professionals could lead the way and help us be more informed at creating healthier places. Again, when the LEED certification was in place, we realized that that was just about making the building perform, making it more cost effective, making it utilize less renewable resources. But we thought we needed to take it to a new level to better understand how people performed and people felt within those places, emotionally and physically. And so Greg, if you wouldn't mind walking us through healthy people, healthy places, and some of the other things that we've been able to work on here in the office.
Yes, thanks, Mike. So as we thought about this internally, we kind of coined up with this healthy people, healthy places, and we latched on with partners because we wanted advice from all these different people. And our goal was to simplistically partnering together to promote a healthy community, economy, and environment. From looking at our plans before they're public to giving us advice, to reaching out even further and grabbing even more people to come work together and build a common language to better understand how public health impacts everybody and all the projects we create. And as part of that, we worked collaboratively with DMU, the Des Moines University right here in Des Moines, and worked with graduate students on helping them share their knowledge back to the larger group.
And one of the things I can say here, Mary Minzer Hansen, I don't know if she's on the line, but she's absolutely spectacular. She's a Department Public Health Director at one time, a department at the DMU in their public health department. And she's always so giving of her time and resources to help so many people better understand how to advocate for public health and public health professionals. So I just want to give a shout out to her. She's an absolutely wonderful lady.
We also made sure we took some time to do conferences. So in 2014, we did the Healthy People, Healthy Places conferences right here in Des Moines. And we shared this information.
We had over 100 people that attended that conference. Whoops, I forgot to put in the slide. Sorry, Greg.
So as part of internally in RDG, we created this program called the Design Residency. We started this in 2011, and last year we had our 9th one. And every year we invite anywhere from 6 to 11 graduate students to come here and advise us. We always have an architect, a landscape architect, and an urban planner. But the 4th highest one we've had, and we've had in 8 of the 9 residencies, is a public health expert, because we value public health. We want that advice. And we offer them a challenge. It might be a design problem. It might be something we're working on internally on a project, or give us some thoughts and ideas and be like a think tank. But over this 3 days, they come up with an end product that we share publicly on the Friday afternoon. And in 2014, we came up with this graphic that you see on the left. But our team of 9, we had an architect, interior designer, artist, cultural geographer, a planner, a planner in health, writer, and law. And these collectively made this graphic that helps us to better understand what is that place and explore that context.
And what we're really looking for is a way that, because one thing that Nora, Greg, and I have realized is that we almost speak different language. Public health professionals have a language, design professionals have a language. And when we first started together, it was challenging for us to, one, speak the language, and two, be comprehensive enough in our thinking so that it's a depth and breadth of understanding of how to talk about public health. And this is something that this design residency helped us do. Put together a language chart per se, and a way to communicate and interpret how to go about problem solving with a health lens first, not midway through it or last. And this is that chart that we created. And we looked at the natural, the cultural, the human, social, political, fiscal, built, and a futuristic health lens, so that when we would go to projects, we would have to talk through each one of these lenses as we addressed the project, as we addressed the owner on trying to solve the design challenge that he presented to us.
And these 7 capitals plus future really helps us to ground us and give us different lenses to better understand things. And as we look at this the style, as we use it on all our plans, regardless of size, from a regional strategic planning, healthy places, healthy people, the Parks the People plan that was done for the entire Iowa State Parks, to more of planning and just looking at neighborhoods, down even to sites in a previous design residency.
And so one of the things we were able to do as we were doing the Parks to People plan, we actually had Mary Mintzer Hansen, we had at the time Kent Sovereign, and Rebecca Goldsmith. She's gotten married, and I don't remember her married name now, but they were literally involved in crafting a health message for the Parks to People plan. So now when the state park system spends money on park improvements, we know that there's a lens of health in there as they're deciding future master plans or development of facilities. And that's a great thing. If we wouldn't have had that partnership with Mary and her public health partners, we wouldn't have been able to be so successful communicating to the governor and others that public health is an important component to state park planning. And then as we worked through the state park planning, we also drifted down into regional plannings from a county perspective. And again, utilizing this public health lens, we were able to work from a municipal, county, and state park planning effort that brought all of them together, talking about the creation of these outdoor environments and how they do favorably impact public health. Greg?
So as looking at it from a county perspective, we did Jester Park Nature Center. And this is where you can see some of the renderings and the images we put together. And we use these same 7 capitals to think through this project. One of our capstones was actually finished up last year or 2 years ago, Live DSM right here in Des Moines, where we looked at the city and the parks and how does all this connect, and health, equitable, the trails network, and building a community were these big lenses we looked at. And as part of this project, we formed lenses for the community. The first off is a health lens. We looked at the 3 of the 5 METS syndromes, and you can see the health map down the lower left in orange, where we highlighted where areas that are having the most need because of their risk for high cholesterol or diabetes or limited access to trails and public space. We had a social lens to look at where people congregate. What are those social neighborhoods? Where are those groups at? How do we target them? Where those boundaries lie? And what life stages are they at? So we can be better informed of that. But our big piece became the gaps map, where we looked at trail access. What's the reach of the trailheads? Where are the trails at? Where are they missing? The equity lens, equity versus equality. But when we look at this equity, we target people that we need more help, who cannot afford on their own to make things happen. And park access. You know, where do we have parks and facilities at? And collectively, all this together makes lenses for the city to better understand, to add metrics, to see how their community is changing, both today and in the future as they weigh new projects, and to better service the community itself.
And the great thing, Greg put a lot of this work together. It was just wonderful. Ben Page is the Park and Rec director, and Yogi Shah works at Broadlawn Cemetery, and I'm always struck by the conversation that Yogi provides. He is always communicating that based on where you live within a community, you have a life outcome and a life year expectancy. And so in the diagrams here, we could, for the first time in the history of the Des Moines Park System, dating back from 1876, you can identify where we are investing in communities and where we're not, where the health deficiencies are, and where the islands are that we need to rethink about our equitable approach of investing in communities so that we can provide opportunity for all. And Ben Page is excited about taking this plan and moving this plan forward from a social equity, racial equity, and economic inequity perspective. So this document, this tool, thanks to Greg, will help the Parks Department be more thoughtful as they start to reinvest and rethink about their facilities throughout the city of Des Moines. And again, we couldn't have done this if it wasn't for our public health professionals and partners that we work with continuously.
And so we also have done this for Clive Greenbelt and also put these icons on as well to better understand the community.
This is a project that we're finishing up phase 1 on. And again, one might think, well, what in the world does Waterworks Park have to do with health? We receive majority of our drinking water from Waterworks Park. This landscape had to be tremendously resilient because it was going to flood all the time. We realized that this town has real great interest and passion in places of gathering, places of celebration. And so we utilized all of those as a primary design tool to try to make sure that this park, as it develops, lives up to the great offering that Gray's Lake has provided to the city of Des Moines, and that this would further continue that great place of destination, that great place of offering from a active recreation, passive recreation perspective for the Des Moines Park System and beyond. And so a place of celebration, a place of gather is something that we think is really important from a perspective of social well-being. And so making sure that we had an amphitheater that could cater to a small audience or a huge audience was tremendously important. And I see you're getting on because you're probably saying time to wrap this thing up. So what we would like to do is challenge people as we have just a minute or two left. You have a choice. Which environment do you want to live in? You speak the language, you have the knowledge, you have the expertise, you collect the data. Help us be more thoughtful in selecting the right choice. Get involved. Each one of you municipalities has boards and agencies that you can be active in and inform them on how to make better choices from a lens of health and wellness. Become a partner in all that you do. Engage a design professional, because most of the design professionals can't wait to have a conversation with you, involve you in your projects. Thank you very much.
Thank you, Mike and Greg and Nora. This is a great presentation. And as I told Mike before we started, I attended that 2014 meeting at the Botanical Center, and it was fantastic. So inspiring to see the work you're doing. Some of the questions that we've had coming in, you've already answered, like how do you get involved in a personal level if this is not part of our work already? As public health professionals, you know, we are dedicated to addressing the social determinants of health. So I appreciate those examples that you just gave. One question, actually a couple people have commented on this, that this work, and especially the comprehensive plan and the equity evaluations that you did, is so similar to work in public health called health impact assessment.
Yep, it is.
Wondering how familiar you are with those. We have yet in Iowa to complete, to really adopt health impact assessments as a critical planning tool, and wondering how public health and planners and architects like yourself could maybe come together to advocate for starting to adopt health impact assessments in our strategic planning and policy planning.
So first of all, great question. There is a, so the question is, how can public health professionals get involved? What expertise do they provide? How can they better inform our projects? And the health impact assessment is absolutely one of those areas. We for instance, have a series of projects that would love to be able to have people who are knowledgeable in evaluating the decisions that are made either by the owner previously to hiring us or during the design process. For instance, crosswalks or food islands or park aesthetics or a variety of other areas of interest. You have the knowledge and the understanding of the data where you could come in and help us evaluate during the decision-making process how to make better informed decisions. I appreciate the desire to come back and evaluate a project after the fact, but frankly, it's after the fact where we need public health professionals is during the programming and planning for projects. And so we think that's an area where you have the expertise. The challenge with Iowa, and I would agree, Minnesota, Wisconsin, Chicago, there are more public health professionals that have carried out those evaluations to a greater degree, and we just haven't had the opportunity here in Iowa. I don't necessarily know why that is the case, but I think if we could partner and get that done on a couple of projects, I think we could find that value, provide that to owners, and I think they would like us, hire us early on in the planning process, not after the fact.
Yep.
Did that answer your question?
Yeah, I think so. I think there's all sorts of opportunities for us to work together, including, you know, of course, this stuff requires funding. So there's opportunities to be advocates as well as educators on this to make this part of our systems change thinking. Another quick question here. It gets back to the kind of what can be done at an individual level. And speaking of a question has come in about the climate emergency is critical, but so many of our jobs are not directly involved in climate mitigation, climate change. So how can we as public health professionals get involved in that level when some of our jobs may even be changing or disappearing overall? I think, Greg, you maybe wanted to comment on that one?
Yes. So I shared kind of at the beginning, one of the unique background things that I bring to RDG is I do have a degree in meteorology and climatology. And so as I'm working both internally within our design practice of how do we address climate change on our projects. And, you know, everybody has a stake in the climate emergency. Little steps do make a big impact, from choosing what you eat or how often do we drive. And as Mike showed in his presentation of how much just us working from home, making a dramatic, sizable impact that we can see from space every day. The terabytes of data that we're generating gives us that opportunity. But we're also getting this opportunity to get a sense of how, you know, when we have less NOx, nitrous oxide in our air, how much better people are breathing. How is this going to impact versus our pollen? And we're starting to get this new data that we've never had access before. And as you think of what's the average person can do, it's about, you know, reduce, reuse, recycle. And it's about thinking critically, do I actually need this? Or is there a way, can I upcycle? Or can I put my money where my mouth is, per se, and target my spending to companies who align with my values? Those are ways you can easily get involved and truly make an impact.
And so I would build on that. I think that's a great comment. We have a group called Healthy People, Healthy Places. We meet here at the office. We meet here quarterly. We have public health professionals in a variety of different perspectives, whether you're environmental or whatever public health realm you're in. We come in the office and we talk about projects. The ability for that discussion is tremendously helpful. And what I realized is that whether you live in the metro, or I'm originally from Spencer, every county has a public health professional. Every county generally has proximity to doctors and people who live in, who work for hospitals. I've never had a public health professional ever say, I'm not interested or I can't help you, ever. Or I won't speak at your conference, or I don't want to help you on your project. I've never heard that. I've never, ever heard that. The information that you have is incredibly valuable. I want to know how important from a data perspective it is to put a trail in a neighborhood that's never had a trail before. I can't get access and I can't interpret that. You can. You can get access to and provide that to me. I then can go to a council and we can talk about values not just based on dollars, but values based on kids saved, because we can improve the built environment. You help us make that argument, and that's worth its weight in gold.
Yeah, I think that's a great plug for public-private partnerships and looking at how thinking outside the box how we can work together. I was going to say that, I mean, as we kind of emerge from COVID, which we eventually will, we are longing to get back to normal. But I think if we're a silver liner kind of person, you know, looking at what opportunities does this time frame in our lives give us to rethink some of these things, I think it does give us the opportunity to redefine what our normal is going to be and what we accept as that. And when it comes to equity and space use and partnerships. So I thank you all for the presentation that you've given us, for the work that you're doing, and the way you're engaging these cross-sector partnerships. And that's truly the way that we are going to solve these problems. And make great strides. So thank you, Mike, Greg, and Nora for your work. Thank you, Aubrey, for the work that you are doing to address food insecurity in our communities. And thank you for everybody on the call today who's sent in great questions. I know we couldn't get to them all, but I hope you still found it to be very engaging. And you have the contact information for everybody, all of our presenters today, so I encourage you to reach out to them. They're all great people who are happy to engage. We do have more presentations coming up. Our next one is tomorrow at noon, where we'll have 3 presentations actually, talking about diabetes management, cancer survivors, and private wealth. So I encourage you to join us tomorrow. I encourage you to join us every day next week as we continue to learn from our colleagues and experts around the state. As I say every time, as a good reminder, we may be social distancing. Hopefully we are social distancing, but we are still together. We are still a network, and we are still colleagues dedicated to serving public health in Iowa. So thank you, everyone, and we'll see you tomorrow.
Thank you.
Thanks.
Thank you.